Dr. Sherry Berger from VetVine here this week. Pleased to be welcoming a colleague who's joining us from the University of California at Davis, Veterinary Teaching Hospital, Dr. Melissa Bain. Dr. Bain, welcome.
Thank you very much.
So pleased that you can join us today. We were just going through a recent JAVMA and came across a very interesting article. I know that will be of great interest to our audience, those who are interested in animal behavior, but also I felt really hit home on levels relating to our work environments and our client care. And I'm hoping that you would tell us a little bit more about this study and kind of what you found.
Sure. So a former student of mine and I did this study, and I do want to acknowledge the student. Her name was Whitney Engler, and unfortunately she passed away just a couple of months before she were to graduate. So I'd like to honor her with this paper and make sure that her name is never forgotten in our realm. So she did a lot of work on the study, and she had a couple of friends that helped her as well. So I definitely do want to acknowledge Whitney. So when I met with Whitney to design this study, she had a real strong interest in behavior, and she was able to get some funding for the study to look at the effect of music on the behavior of dogs and cats in a veterinary hospital. Due to the small numbers of cats that we enrolled, we just looked at the dogs, so unfortunately we have no data on the cats. So we utilized the dogs that entered into the community practice here at the teaching hospital, and we enrolled dogs that were healthy or coming in for general exams, no serious illnesses, no euthanasia appointments, and no technician-only appointments. And we asked these owners of these pets to fill out a survey when they came in and during the appointment time, and the dogs are randomly assigned to one of the 3 exam rooms. One exam room had no music playing. One exam room had classical music playing, and one exam room had a specific dog music that's commercially available for dogs called Through a Dog's Ear, playing in the 3rd exam room. So our classical music was also the same songs as the Through a Dog's Ear, but set at the regular cadence, not the attenuated music that Through a Dog's Ear is. And the rooms were rotated through. So throughout the summer, we enrolled 74 dogs into the study. And we asked these owners, can you describe your dog's anxiety level on this ranking score in the waiting room first, and in the exam room before the exam and during the exam. So we asked the owners, how anxious do you think your dog is? How aggressive would you rate your dog? And we compared it between the 3 rooms. Since it was a relatively small number of dogs enrolled in our study, we did combine the music groups. When we looked at all 3 groups separately, there was no difference between the dogs that had Through a Dog's Ear playing or had the regular classical music playing. So we did combine those 2 groups of dogs together and compared it to the dogs that were in exam rooms with no music playing. And we found no difference, so I'll be honest on that. In the owner's rating of their dog's behavior, whether they had music playing or no music playing. But we did find some interesting findings. Owners in exam rooms in which music was playing actually rated their experience better than if they didn't have music playing. It was more so related to how satisfied were you with the time spent. And since it's a teaching hospital, they can be quite lengthy time that they're waiting in an exam room for a student to come in, take the history, step out, talk with the clinician, come back in with the clinician. It's all very well done, but it does still take time. And owners that were in exam rooms where music was playing actually reported themselves to be more satisfied with the time spent in the exam rooms. So that was one finding. The other finding that didn't have anything really to do with the music, but had to do with other aspects of veterinary care, was owners rated their dog's anxiety level in the waiting room much greater than their anxiety level in the exam room. And what that can tell us in veterinary practice is get the dogs out of the waiting room as quickly as possible and into an exam room. So it's small things that can make a big difference. And we also asked the clinicians, there was 3 clinicians at the time, and we asked them to rate each individual dog's anxiety and aggression level. And there was a difference between the rating levels between the owners observations and the clinician's observation. And the owners were more likely to rate their dogs as higher in anxiety and aggression than a clinician were to. So that's kind of the take-home message. One other thing that we did know statistics on, but when we're talking with the clinicians, they like the music. So they seem to like it. So, maybe they were happier. I don't know. We couldn't quantify that, but all three of the clinicians said they enjoyed having the music in the exam rooms.
So I guess these findings were a little bit discordant with other studies in the past that have looked at music, right? I know that your references list a lot of articles that have looked at other species, shelter animals. Can you remark about why maybe your findings were different than past studies?
Sure. We only had 74 dogs enrolled in our study, so it was a small sample size. And another thing is we relied on owners' rating of their dogs' aggression and anxiety levels. We did try to do some video recording. One of the exam rooms had video feed into the exam room, so we did start recording some appointments, but we had ran into technical difficulties, we'll just say that. And that would have been certainly another way to observe the animal's anxiety level and aggression level in the room from an objective observer, blinded observer. So we talk about, decreasing stress. There's a lot of things that veterinary practices can do to help increase the comfort level of their patients, and certainly increase the comfort level of their clients as well. And easy and inexpensive things, something like I already mentioned, getting the animals into the exam room quicker and not having them wait out in the waiting room. Can we have a separate cat area where owners with cats can wait separate from the dogs? Can we put the cats up on little shelving units so that if a dog were to walk by and it won't be able to stick its nose into the carrier? Can we cover each cat carrier with a towel that's sprayed with feel-away as soon as they walk in the door? Can we change the mood lighting in the waiting room? Can we have a fountain? Can we have a coffee maker or a Keurig maker or cookies for humans? Just to make people happier, to be there, a little less stressful. Have updated magazines, things that make people happy. Like when we go to dentist office or doctor's office, what do we want to see there? We don't want to see big fluorescent banks of lights and loud noises and smells like cleaner. And if we're acknowledging these things, the animals certainly are going to be acknowledging these things as well.
Well, yeah, and I was going to remark, a lot of our animals pick up on our vibes or the energy that we put out. And I wonder how much of that plays into your paper. Did you think about those kinds of things? Any correlation between how the owners, for example, rated their visits and the scores that the dogs got?
We didn't look at that. So that would be something, if they were more comfortable or happier, do they rate their pet's experience better? And it's going to be always hard to tease that out. And then we look at, other things in exam rooms when owners are more comfortable in the examination rooms with their animals. Do they feel heard? Do they feel like the veterinarian's listening to them? And is the veterinarian taking time with their pet and not rushing through the procedure? The animal certainly is going to feel better because it's going to be handled in the lowest stress way possible. And the owners are going to be happier because they're going to see the care that the veterinarians are giving. So it's all interrelated. And frankly, I don't think we need to separate it out because it's how we should practice.
Right. And in our last update, we talked about, why is it that sometimes we say things to clients and they don't seem to hear it? And part of it could be due to the fact that they are anxious and they are upset and maybe not comfortable. And so their brains are not tuned into listening and or absorbing.
Oh, absolutely. When we're stressed, our veterinary students here at UC Davis go through a 4-year-long communications course, and they have simulated client experiences in which they have difficult conversations, money, angry clients, disgruntled clients, clients with a backstory, all these things, and educating veterinary students and veterinarians on checking in with the client and seeing where they're at and whether they're stressed about the diagnosis you just delivered or the stress level that their pet is facing at that moment because he's uncomfortable or aggressive at the vet clinic, all of that plays a role into what clients are going to be hearing. What the paper obviously is focusing on the music, and that's all we looked at in this paper, but it's going to be beyond the music. And music it's easy, it's inexpensive, and it does no harm. We know it won't hurt. And if we can expand it, we just played it in the exam rooms. We didn't play it out in the waiting room area. But is this something that can then translate to in the treatment area? And I know when I was in general practice, we played rock music and pop music and dance music, and we shouldn't. Perhaps it's when we're looking at playing classical music in the back area, in the treatment area and surgery areas. One study I did reference in here was a study looking at cats under anesthesia. So under anesthesia for being spayed, and they reacted differently to different types of music. So while we think they're asleep, they're actually responding to ambient noise.
So are there any specific classical tunes you would recommend to play or to avoid?
The quiet ones, no 1812 overture, things like that. So, certainly clients are going to be purchasing the Through a Dog's Ear. And while we don't discourage that by any means, the original songs that we played that were the same songs as the Through a Dog's Ear would be a good starting point. Or, the Through a Dog's Ear certainly would be something we could recommend as well.
I really appreciate you taking the time to talk to us about this today, and thank you.
Well, thank you very much for having me.